Every day across the country, people line up at food pantries to get enough food to feed their families.
I'm a disabled vet on a fixed income. There are weeks I just don't have enough money for food.
I've been working since I was a kid. It's a struggle just to make enough to survive.
My job, it just doesn't pay enough for rent, bills, and all I need to take care of my 2 kids.
The problem isn't just providing food to those in need. It's about providing healthy food. In the U.S., 34 million people have no or low access to healthy foods. That's enough to fill the average NFL stadium more than 560 times. It's a problem that stretches from the heart of every city to the rural corners of the surrounding counties. A lack of healthy, nutritious food can lead to preventable health issues that often lower life expectancy. And that's not okay. Because everyone, everywhere, regardless of race, income, or zip code, deserves to live a long and healthy life.
Unfortunately, in many of these neighborhoods that we see a high poverty rate or high food insecurity rate, they are lacking a full-service grocery store. And what that means is that the accessibility of fresh produce, a variety of lean proteins, and those type of items are not really accessible, and they're very limited for many of our families.
So just think about the stress that someone goes through when they have to make the decision of not having enough money or enough healthy food to give their kids. Do I eat better today versus I pay my rent? Do I, pay my transportation versus buying healthy foods? I can tell my patients all day, eat healthy, but if they don't have access to healthy foods, then they won't eat healthy.
We need to be nimble, flexible, and innovative in how we expand access to nutritious foods for our neighbors.
From Seattle to Boston and communities all across the country, the American Heart Association has worked alongside partners to do things like salvage good food from grocery stores, restaurants, and schools that would otherwise be thrown away, make fresh produce available through temperature-controlled food lockers, support local food entrepreneurs to increase access to healthy food in low-income communities, teach neighbors how to grow food and convert vacant lots into community gardens, and so much more.
When people eat healthier foods, there is significant impact that can happen in their whole body, from their mental state to their physical state. Healthy food is medicine.
In my own work as a clinician, I've grown to recognize the American Heart Association's strength in making medication discoveries, creating smoke-free rooms, to training people with life-saving CPR skills. It's their work in the future that's really exciting. This effort to really address a lot of the inequities in healthcare access and even things like nutritious foods will have large impacts for the populations that all of us are now committed to serving.
The American Heart Association is committed to improving lives by getting healthy, nutritious foods to all our neighbors. And you can help. Your support will save lives.
So welcome and thank you for joining us today. I'm Brian O'Grady, President of Health Plan Markets for CDPHP, and I have the honor of chairing this year's Capital Region Heart Ball. And today we bring everyone together because we're excited to launch our Healthy Food Drive. So by participating in our Healthy Food Drive, you're empowering the community, our community, to provide nutritious foods that our neighbors need to live full and healthy lives. A lack of consistent access to enough food and lack of access to nutritious food has a negative impact on health, including chronic disease and poor mental health. And as we all know, a healthy eating pattern and lifestyle are important for good heart health, and eating healthy meals is easier when families have access to nutritious food to prepare. Food pantries in our region and across the country want more healthy options, but donations are low, and donations are also low in nutritious value. So limited availability to food that carries nutritional value makes it very difficult for organizations to support health needs and may perpetuate the inequities that contribute to negative health outcomes. That's why a healthy food drive can help fight food insecurity. It's a direct way that you can support nutrition security in our community. So as part of this volunteer experience, we want to share more information about how you are making an impact through this activity and how this healthy food drive directly supports the mission and work of the American Heart Association. So during this presentation, you'll learn more about why the American Heart Association is focused on nutrition security, the urgent need for nutritious food access, and the specific action you can take as a volunteer for the American Heart Association to help address the issue. So during the presentation, please put any questions you might have in the chat, and we'll save time for answering questions at the end. But at this point, I'm happy to introduce the chair of the Board of Directors of the American Heart Association, Kawita Adams.
Hi, thank you so very much, Brian. I really appreciate that warm introduction and getting the stage set for what we're doing today. And one of the things that we really want to talk about is food insecurity. And food insecurity is defined as the lack or uncertain availability of enough food for an active, healthy life. When we think about food insecurity, we might just think about that first part, which is having enough food to eat. But we've also learned that an important consideration is also the presence of any anxiety or worry about food's availability. The American Heart Association recently released a statement that defines nutrition security as having equitable and stable availability, access, affordability, and utilization of foods and beverages that promote well-being and prevent and treat disease. The difference, as you can see, between food insecurity and nutrition security is that food insecurity is about access to a certain quantity of food, whereas the nutrition security considers the food quality, as well as the ability to utilize healthy foods to support health. This underscores that nutrition security goes beyond just the access of the healthy foods we need to thrive, but also ensure that all communities have the knowledge and the means to eat nutritious foods across their lifespan. Here are some facts regarding food insecurity, how many people are affected, and some of the negative health impacts of food insecurity. To exacerbate an urgent need, the rising cost of produce and other health food depends on inflation and supply chain demands. These issues and the changing way in which we eat and shop are critical to this key piece. For individuals that can't afford healthy options, this increases the likelihood of detrimental health conditions, which could be mitigated by eating healthily. A lack of consistent access to adequate nutritious foods contributes to negative health outcomes, including chronic diseases like diabetes, hypertension, obesity, and those listed on the slide before you. So now that you know a little bit more about food insecurity and nutrition, locally, I want to share why the American Heart Association is focused on these issues. At the American Heart Association, our work truly centers on the pursuit of health equity. And we know we can't even begin to talk about health equity without ensuring that everyone has access to foods that promote well-being and prevent disease. Eating nutritious foods is an integral part of the equation for a healthy heart. Our team joins forces with local organizations and clinics, especially in under-resourced communities, to help identify and break down some of the big systemic inequities that contribute to barriers to health foods. These efforts build sustainable solutions to address intersecting risk factors for heart disease and stroke, one of them being access to nutritious foods. When we talk about these efforts, we focus on something called policy, systems, and environmental changes, which is essentially our work alongside community and clinical organizations to have a long-lasting impact on health equity. The overall goal of these collaborations is to ensure sustainability for the changes so that longevity of the program's success is not solely dependent on the association's involvement. Some of these programs and initiatives around nutrition security include capacity building for produce and perishable foods, developing nutrition policies that help organizations advocate for the provisions of more healthy, culturally relevant foods, and protocols for food insecurity screening and referral. Health equity is a major part of our organization's nationwide goal. Every person deserves the opportunity for a full and healthy life. As champions for health equity, by 2024, the American Heart Association has made a commitment to advance cardiovascular health for all, including identifying and removing barriers to healthcare access and quality. People suffer when they lack access to quality care, nutritious foods, and other basic health needs. And without opportunities to enjoy full, healthy lives, people often get sicker and unfortunately die younger. Unfortunately, people living in lower income areas have significantly higher rates of unhealthy diets. Many factors contribute to this problem, including limited income and opportunities, also have the potential to restrict the ability to buy healthy and nutritious foods. The lack of transportation is a factor, or relying on public transportation to grocery shop. Living in a food desert where no healthy options are available. And for many, the only sources of food in their neighborhoods are either from fast food locations or prepackaged items at the convenience stores. Because of this, and many historical systemic inequities that were laid bare by the pandemic, unhealthy diets can be the only realistic option for many people. Statistics show unhealthy diets are regular among nearly 60% of Black and Hispanic people living in the United States. To overcome these inequities, various approaches are needed to ensure that everyone has access to culturally appropriate healthy foods, unbiased healthcare, and essential resources that improve over health and well-being. It is estimated that about 1 in 10 households in the US experience food insecurity in the year 2020. 50% cardiovascular disease is due to poor diet, and less than 10% of people eat recommended amounts of fruits, vegetables, and whole grains. Poor nutrition can lead to poor health. When people struggle with making their food dollar stretch further, they may have to sacrifice quality or variety or even skip meals in their entirety just to make ends meet. Obesity, heart disease, diabetes, and some types of cancer can be some of the devastating results. Trouble in school for children and teens, increased stress, and poor mental health are also risks of not having a healthy diet. The American Heart Association believes in the right to healthy food for all people to live their best lives. That's why we're working to improve both nutrition and food security for everyone, everywhere in America. Nutrition security is our priority. Let's look more closely at a few health impacts tied to food insecurity. The first is obesity. People who experience food insecurity have poorer diets than the general population and are more likely to be overweight or obese. Children raised in food insecure households are also more likely to become overweight or obese by adulthood. It may seem counterintuitive to think that the lack of food and obesity work together. However, when you break it down, it only makes sense because low-income neighborhoods often lack access to stores with healthier options, or when available, they may be of poorer quality and less appealing. The lack of transportation limits the food that can be secured. Fast food is often more available in some neighborhoods and can be less expensive than healthier foods. And food insecurity can lead to a vicious cycle of food deprivation and overeating. Obesity is correlated to serious health conditions such as type 2 diabetes, cardiovascular disease, and some cancers. Thus, by offering nutritious foods, food banks can have a significant impact on the health of low-income individuals. Another impact is diabetes, which, if left unchecked far too long, can lead to serious and often life-threatening complications, including heart disease, kidney disease, and other infections. Recent research suggests that food insecurity is a risk factor for developing diabetes. In fact, a large survey conducted in the United States revealed that diabetes risk was approximately 50% higher among adults in food insecure households than in food secure households. Food insecure adults are 2 to 3 times more likely to have diabetes than adults who are food secure. Food insecure pregnant women are at a greater risk for gestational diabetes. Diets common in food insecure households, those with a lot of inexpensive carbohydrates, may increase the risk of diabetes. This illustrates why it's important to consider the nutritional content of food we distribute to our neighbors. By supporting your company's health food drive, you are empowering local community organizations to provide nutritious foods that our neighbors need to live full lives and healthy lives. Additionally, you are raising the awareness about the importance of making healthy food drive donations as opposed to food that contributes to chronic disease. Over the next few minutes, we will review guidance to help you know what types of donations will help support healthy life and additional actions you can take to support the American Heart Association's work on nutrition security. Now, I would like to introduce you to CEO of the Region Food Bank of Northeastern New York, Tom Nardachi. Tom, thank you for joining us today. We are so happy that you're here.
Thank you, Kawita, and thank you to the American Heart Association and CDPHP and all the sponsors for this great initiative. Kawita and Brian, I want to take you guys on a road with me, right? Because you just said everything that we say every day, and you said it in a great way. So thank you so much for laying it out and explaining the seriousness of the challenges that we all face. 1 in 7 kids in the capital region is food insecure. My kids are 12 and 9, and every day when I come to work, I think of that number. I think about the kids that went to school today without nutrition, and I think about what type of day they had and the challenges that they faced. And every day when I go home at the end of the day, I know who I work for at this job at the Regional Food Bank, and I'm so blessed to have this opportunity to be in this position to do the work that we do. This time of year is very important for the charitable food system. Obviously, the holidays are incredibly busy, and from September through December, we're all out. We were all out all through the holidays, and but it's important at this time of year that we restock the shelves. It's really important that pantries get the food that they need, because the need doesn't go away with the holidays. The need is as great as ever right now. This past year in 2023, the Regional Food Bank distributed 2 million more pounds of food than we did in 2022. It's almost as high as the peak of the pandemic. So in terms of the need in our community, it's as great as ever. And we're faced with limited and reduced resources. We don't have some of the funds that we had access to during the pandemic. So everything that we do at the Regional Food Bank centers on collaboration. The partners on this call, the supporters, the list of people at the front of the screen, they're people who we work with all year round and year over year. And so to everyone who's participated and helped us through the years, we really appreciate it. And we appreciate that year round, year over year commitment to help us help neighbors in need. What we do at the Regional Food Bank is we collect and distribute food to hundreds of community partners, agencies, and programs, right? So we're the hub that collects food, and we put a specific emphasis on healthy food and on choice and on food that people want. And we utilize all the resources at our disposal to ensure that healthy, nutritious food is in the charitable food system. New York State has a program called Nourish New York that was created during the pandemic that was made permanent in last year's budget. Nourish New York allows the food bank to purchase food from local farmers and local New York producers. So this is local food, local produce, locally produced yogurt that we get and distribute throughout our charitable food system. That's one program that we are proud of that we want to expand in New York State. We also have started to pilot, as other charitable food organizations have done, our food is medicine programs. We're working with local hospitals, Albany Med, St. Peter's, others, to make sure that we're working to provide solutions to people with health challenges. And that's a program that we're proud of. We're proud of the work that we're starting to do, and we see large expansions of that type of programming in the future. Various items that are collected during this food drive will be brought to the regional food bank. Our volunteers, we have hundreds of volunteers who come here every week. Kawita is going to be here on Monday, right? So you're going to come and you're going to sort this food that we collect. The food gets sorted by volunteers, and then within a matter of days, that food that you collect and give to us is out in the charitable food system. So that food is very important, even though we have programs like USDA and Nourish New York that allows us to acquire food in mass quantities. The donated food, the rescued food is super important to pantries because it provides variety. And we want people who go to food pantries to have a shopping experience. We want to make sure that there is dignity in the charitable food system, and having choice and having variety is part of making sure that there's dignity. And to make sure that pantries can have access to items that they might not otherwise have. A lot of that food comes through donated items. And as I said, the need now is as great as ever. I've been here for 6 months. I'm the new CEO here, and I'm just shocked and amazed at how big of a need we have in this community. I always consider myself someone who felt like they had their finger on the pulse of the needs of the capital region, and this is one that is way bigger than I ever imagined. The scope is so big, and the nice part is the thousands of people who contribute, who give, who are committed, the companies who are committed. It's really what makes life a little better for people in need, and that's the work that you're all doing here. And I just want to say thank you so much. Kawita, back to you.
Thank you so much, Tom. What a great opportunity for us to be able to participate and assist the region. I do want to say that the next few slides are really important, and for those of you on the call, please make sure that you're looking at the items as we talk about collecting healthy donation items. When promoting your food drive, the goal is to make sure that the majority of the items donated have low saturated fats, sodium, and no added sugars. These foods are the highest in nutrition and lowest in the nutrients that are most dangerous in contributing to chronic disease. You should all have a list of suggested items that you can share with your employees and your teams. If you don't, please reach out to Jessica. Jessica's going to be available for you so that you can make sure that you have a contact person. We want to make sure that you have someone that you can contact. So Jessica will be available for that. Just some key things to know: that the region food bank cannot accept donations that are in glass containers. Please make sure that you're aware of that. Canned meat with low sodium, such as tuna or chicken, whole grains, whole wheat grain pasta, those kinds of things are absolutely appreciated. Brown rice, oatmeal, barley, quinoa. Please understand that there's canned vegetables and we have canned beans. Those kinds of things are also acceptable. Reduced sodium, like soup, unsweetened applesauce, unsweetened dried fruits, vegetable cooking oils, if those are things that you are collecting. We also ask that you pay attention to the expiration date guidance. Did you know that the FDA does not require food to have a sell by or best by or use by dates printed on food products, except baby food? These are arbitrary dates that are printed on food items by the manufacturer and based on expected handling and temperature exposure. We still ask that you pay attention to that. Generally, food access organizations accept perishable food items past the sell by and best by dates that are safe to eat. They do not accept donated food that has passed its use by date. The exception is that if food past its use by date is frozen, it may still be accepted collecting donations of food shortly past its sell by date or best by date. These things, please make sure that you check with the site first to ensure that these items meet the guidelines, because we want to make sure that we are handling food and donating food in a very safe way. There's a heart check mark. The heart check mark makes it easy to spot heart healthy foods in the grocery store or when dining out. Simply look for the name of the American Heart Association along with our familiar red heart with a white check mark on the package or menu. But not all red hearts you see are from the American Heart Association, so make sure that you're looking for the American Heart Association name to make sure. When you spot the logo, the American Heart Association's heart check mark, you will instantly know that the food has been certified to meet our nutrition requirements and that it is a good first step in creating an overall sensible eating plan. The next slide talks about healthy food drive details. Please make sure that healthy food, for the healthy food drive, it is January 15th through the 25th. CDTA will collect donations beginning February 1st. And this is the to-do list. Set up a donation bin, spread the word, collect donations, send out reminders through the campaign, and celebrate with us at CDPHP on February 1 at 5 p.m. Before we wrap things up, we have a few minutes to answer some of your questions. I know we're running really close on time, but Jessica and Kathy, if there are any questions, you can facilitate that at this time.
Thank you. And thank you, everyone. If you've tried to ask questions, you may have noticed that we've had some problems with the chat. So if you have a question and you'd like to come off mute, we're happy to field that right now. And I know that Jessica will send her email address to all the company leaders, and we are happy to answer any questions afterwards. And we apologize for the technical glitch. So does anyone have a question?
Thank you.
all.
Oh, go ahead, Jessica.
No, I'll pass it over to you, Quita, but I just wanted to say thank you all for being here, and I will be in touch to answer any questions that you might have.
Thank you again to our sponsors, and thank you again for volunteering for the American Heart Association. We appreciate all of you, and let's have a great food drive. So thank you so very much. Have a great afternoon.
Thanks, everyone.
Thank you all.